So for those of you who don't know what hostile cervical mucus is, in some cases the cervical mucus can actually go on the attack, and where it kills the sperm before it ever has a chance to make it to the awaiting egg. So in this situation, a pregnancy becomes impossible because the sperm is unable to penetrate the cervix, and it's actually more common than people might think. And there's a couple of reasons why cervical hostility may exist. The first one is because of an acidic diet. So usually cervical mucus is alkaline. However, when a person is eating a lot of processed foods, soft drinks, meat, dairy, sugar, this can actually cause the body to become acidic. Therefore, cut out these foods and increase fruit and vegetables, nuts, legumes, and lots of filtered water to make your body more alkaline. The cervical hostility may be because of an infection in the lower reproductive tract. So when there's an infection in the lower reproductive tract, the vaginal fluids can actually become infected, and the sperm is then damaged or killed by this bacteria as it enters the vagina. It might be because there's too many anti-sperm antibodies in the cervical mucus. So these antibodies actually work to immobilize the sperm and prevent them from entering the cervix. And another reason could be because the cervical mucus, that is actually too thick, or it is too scanty. So if the cervical mucus is too thick, it'll be hard for the sperm to travel through it. And if the cervical mucus is scanty or not present at all, it will be impossible for the sperm to make its way to the egg. So to test for cervical mucus hostility as a potential cause for your infertility, you can actually have your doctor remove a sample of the cervical mucus 8 to 12 hours after intercourse, and they will closer examine it. This will also help to show the physicians the degree of penetration of the sperm. So if there are more than 20 actively moving sperm found per field, then the cervical hostility is not a concern. But if there are less, further testing may need to be done to determine if the woman's body is indeed actually attacking her partner's sperm. So depending on the cause of the cervical hostility, treatment may include treatment to clear up any infections. We want to give remedies to help thin the mucus or promote the production of cervical mucus. We may need to treat the immune system if it is attacking the sperm. We'd recommend a sperm-friendly lubricant if the mucus is too scanty. You certainly want to have an alkaline diet and to drink 8 glasses of water per day to really increase the production of the cervical mucus. And we'd also recommend avoiding coffee and alcohol, as these actually tend to be acidic and also diuretics, which can lead to more water loss and actually more acidity. And so cervical mucus hostility is actually one of the last things that is tested for infertile women, but it can actually be quite common among infertile couples. So be sure to check this common affliction if your doctor's been able to find another cause, if you haven't been able to find any cause for your inability to get pregnant, or if you've been labelled as having unexplained infertility. I certainly recommend working with a natural fertility specialist to help you find the cause and then to address the necessary treatment for your condition. So my advice is to drink more water, use a sperm-friendly lubricant, and seek the help of a natural fertility specialist to help regulate and support your hormones, and then to encourage this production of cervical mucus.